Why is this particular subject so important for us to focus on here at the Arab Health Platform 2025?
Okay, so let's try and keep the energy in the room. I know It's the last session. Why this is so important is because women's health is top on the agenda now. It's top on the agenda for the leadership of the country. They've just published their national policy on improving women's health. And so aligned with that, we are making strides in ensuring that women's health remains on the agenda, and we are redefining what women's health means in the region. Traditionally, women's health in the Middle East has been focused on getting women pregnant and delivery, all about babies. We're trying to redefine what women's health means by offering comprehensive and holistic care that looks after women right throughout their reproductive health, from menarche all the way towards postmenopausal health, and by giving women these options such as the ovarian tissue cryopreservation, and actually these collaborations that we're doing with world experts, leveraging their experience, their expertise, we're able to give women of the region world-class, the latest advancements and innovations right at their doorstep.
I think that's such an admirable aim, and I think that deserves a big round of applause because Dr. Summia has been instrumental in raising awareness for this. I'm going to shake things up and just come around to my panelists as and when the topics are most timely. Professor Simon, if I can bring you in, when we speak about OTC, and we talked about the timeliness of it and women's health being central here, Dr. Summia used a very key word which we've explored throughout day one: collaboration and partnership. Give us an insight in terms of your perspective on that when it comes to M42 and the UAE.
Well, I suppose first I should say that any form of innovation or revolution in medical science is always difficult to drive through. And you really need a partner to do this. And a partnership has to be a high-end, highly respected medical organization, institution. Which is why we're absolutely delighted to be able to partnership with M42 and the Nat Hospital. But the reason for it is, as we well know, medical technology is complex. It's complex in understanding the data. We're analyzing the physiology of the human being and how to interpret that into medical practice. And what we have with our technology here is something that is revolutionary. It's innovative. But as maybe we'll explain a bit later, I actually don't think it is that revolutionary. What's revolutionary is the concept, not the actual technology itself. But to be able to drive it into clinical practice, to be able to make patients' lives or people's lives better. We're talking about the well woman here, to enable her to remain well throughout a period in her life, which is massive change, the menopause. I'm a man. We also have the menopause. We just don't talk about it enough. So, I have to admit that I'm a man trying to work in an area of female well-being, but you need collaborators that are also at the highest end of delivering service.
That's really fascinating, and I'm going to actually ask you to unpack what you said there in case we don't get a chance to come back to that point. Before we bring in Dr. Zahid, you mentioned it's not necessarily revolutionary. Explain that.
Well, if, for example, it's understood that women in the menopause go into what we call the hypoestrogenic state. They have very, very low estrogen levels, and we need to boost that up. So they've been given for many years something called HRT, hormone replacement therapy, fundamentally estrogen. But actually, OTC, ovarian tissue cryopreservation, has been around long, long before we were giving HRT. It's been around starting as a scientific revolution in the 1950s. And the first human involvement in this was in the year 2000. It was used for fertility preservation. And what Profam is now doing is joining the dots, using a little tweak of the technology and saying, well, hang on, if we are preserving a woman's fertility, we're already preserving her hormones. She cannot become fertile without her hormones being preserved. So why not use those very hormone-preserving methods to continue the premenopausal phase?
That's really fascinating, and I think it provides me a seamless link to bring in Dr. Zahid. Dr. Zahid, I want to ask you about how you see OTC evolving as a solution for preserving fertility.
Of course, as Professor Simon just mentioned, it has been around for fertility preservation for decades. Now we have come to learn that we can get rates as good as 57% to over 60% of live birth rates with ovarian tissue autotransplantation after it's been cryopreserved. However, what we are now beginning to learn is its clinical applications, which are much broader, not only for women who are, for example, being treated for cancer, such as radiotherapy, chemotherapy, or strong immunosuppressants or strong immunotherapy, but also, as we have already mentioned, for the hormonal imbalances that strike you after the menopause. So, in essence, it is an ovary or ovarian tissue that has been removed from a woman laparoscopically through a very small operation within about 15 minutes, and it is frozen after a little bit of processing, and then it is transplanted back either into the ovary or into the peritoneum around the ovary to bring back ovarian function in the perimenopause. So in essence, it delays the menopause. But the beauty of it is it's not like hormone replacement therapy. So you don't get a steady hormone replacement. You get similar to a circadian rhythm hitting you just like you were before 50 years old. So that is fantastic. There are other evolutions in OTC, and Prof will shed light more on this, such as changes in cryopreservation techniques, changes in the way the tissue has been processed, the newest technologies in cryopreservation. These things are all adding to the fact that OTC is not just what it used to be for fertility preservation, but now is moving on to broader clinical applications.
Okay, so that's really fascinating to hear, and we appreciate you giving us that insight in terms of it can be done in a 15-minute operation, and it seems literally a very kind of non-intrusive fashion as well. So that's really fascinating. Dr. Summia, we began by setting the scene in terms of the vision here at the UAE, your institution, and how we're putting women's health really on the center stage. And we're doing that here on the center stage at M42 as well. Where do you think the applications of this will be best seen in the population here in the UAE, in the region? Where do you think the most benefit might come?
So I think it's really about now there is pressure and expectation on healthcare providers to be agile and be able to respond to the changing demands and expectations of healthcare users. So healthcare users now expect autonomy, there's greater patient choice, and I think both of my colleagues here on the stage mentioned a really important point about that the science is not new. There are a lot of things that we have in medicine where the science is not new, but it's utilizing and adapting our knowledge of these to further indications. So with this method that's been around since the 1950s, we're increasing women's autonomy. So they're taking charge of their own reproductive health. We're no longer saying you can utilize this only if you've been diagnosed with cancer. But no, women can actually be responsible for their own decision making in terms of deciding their own family planning. They decide when it's suitable for them to have a family. They can delay their menopause. There are lots and lots of complications with the menopause. M42, one of our biggest things is preventative medicine. So let's leverage these sorts of technologies to actually prevent some of those complications in a natural way. There are many women that cannot use HRT because of medical reasons. So by being able to utilize the research and the knowledge that we already have, we can offer them an option that's, as Dr. Zahid is saying, is very easy to do. It can be done opportunistically if you're, for example, having a cesarean section or a laparoscopy for another indication. We remove that small bit of ovarian tissue in a few minutes, can be stored for decades, and then can be grafted back or reimplanted into the body for use for later.
So there's so many interesting follow-up questions I have for you, Dr. Summia. So I'll just put a few to you because I want to bring in the rest of our speakers and open it up to our audience as well. But a very quick one. You mentioned, as our speakers have all said, the science isn't new, but what's making it more accessible now? Is it the level of technology and innovation which is allowing more access to this?
I think actually it's a mixture of the two. So, of course, advances in research and science, but it's actually the expectations of our patients. They're expecting more of us now. They're expecting choice. They're expecting us to be able to utilize the evidence and the research that we're doing for more choices for them. So we have to be agile and react to that demand.
And if someone isn't going through a C-section, then what age would you be recommending for them to take this tissue and store it for decades, as you say? What would be the ideal?
So
very general answers, I'm sure you can come
Prof
up
will
with.
be best placed, but ideally it's before the age of 35. So it's not just the cesarean section. Of course, you can have this procedure done either opportunistically, so if you're having a laparoscopy for something else, or a cesarean section, but you can actually electively opt to have this done as a day case procedure.
That's what I mean.
Yeah.
As in, there's not a byproduct of another op.
No.
But if one was listening into this and they're thinking about an age range, okay, this sounds fascinating, cutting edge, but at the same time, as you say, this is grounded in decades of science and investigation into it as well. Now, it begs the question, what are the downsides? There's always a downside to any intervention. There's always a downside to any type of...
Well, the downside is probably that in a tiny percentage, it might not work. It would also be, again, as we've said here, the most important thing is the power of the woman's ovary. The age at which she...
I feel like that's a sound of doom. I asked the question to Professor Simon
can take it
about
on.
the downside, and I feel like the music from the Hollywood music stores has built up. Yes. Okay. We might ask one of my colleagues to ask the ambient noise is perhaps a little bit too much. Is there any way we can ask our colleagues to turn the music down?
Who is next door? Is it
Okay. Maybe it'll be over in 10 seconds. I do want to make sure that we do have a chance to listen to Professor Simon's answer. It gives you a moment or two to think about that. So, what could be the downsides, and how can we mitigate against that?
No, so the surgery itself, as Dr. said, but everybody will attest to the type of procedure that the woman undergoes is one that is done every day in all hospitals all around the world for different reasons. So if one wants to do it electively, in other words, you're a young woman, actually I'd like a bit of my ovarian tissue frozen now while I'm young, while it's the strongest and it's going to give me the greatest possible hormone protection. Actually, the procedure is really minimally risky, very minimally risky. It's a procedure called laparoscopy. Any association with that happens routinely is a minimum risk, but that's the kind of risk, and it's a daily one. In fact, some would say it's far less risky than some of the cosmetic surgery that people undergo. The only other downside is that in any procedure, there's no 100% guarantee, but 95% of women have hormonal restoration within 3 to 4 months. That's a pretty good outcome. And we know that many women recover their fertility without having to do egg freezing or go through IVF, for example. That is also showing that this technology works very, very well. So I think if you were really to do a risk-benefit equation, in other words, what's the downside? Very little, and huge, huge potential upside.
So as you say, it's more a question of the downside of hope, of expectation, as opposed to kind of a medical downside to the operation of actually doing this. Dr. Zahid, to bring you in, you fantastically gave us a comprehensive answer in terms of the actual nature of carrying out OTC. Is there anything else that we should be thinking of about the milestones that we're reaching at this point? It's evolved, it's changed, and what are you seeing in terms of your particular insight?
I think this is an exciting time. We've heard from the world expert on OTC, but it's an exciting time because I'll go back to what Mr. Hassan said in the morning, that one of his priorities for M42 now, or at least for Cleveland Clinic, was for research and innovation and research and training. And if you take that research part and really focus on it, we come to realize that things such as advancements in cryopreservation and the different techniques, Abu Dhabi Biobank, we have that. We have new emerging technologies in actually 3D bioprinting a new ovary, especially for women who've got premature ovarian failure. Again, it can be done through ovarian tissue cryopreservation, ovarian tissue that's been retrieved. And go on, it goes on. The newest imaging technologies, the newest laparoscopic and robotic technologies to retrieve this tissue. All of these techniques and all of this research that can be done within M42 actually creates a huge amount of data, and we've got the AI capabilities to analyze that data, make the OTC better, and I think the sky is the limit. When it comes to M42 and OTC, the sky is the limit because we have the capabilities to take it to the stratosphere. And because we have the tech and we have the AI analysis and we have G42's backing with it and a fantastic fund.
I think that's a really interesting context that you create there for us to actually contemplate how decades-old science has that actual new boost of energy because of the technology and the funding behind it. So Professor Simon, I know you want to come in.
Just one point that I think is really important and why M42 is particularly important in all of this is that let's not forget that every woman on the planet, if she lives long enough, will go into the menopause. And with current health, she'll probably be as long in the menopause as she was in the premenopausal state. Human beings have never had that before. And now that we have this opportunity for women's well-being, well beyond what would have been a menopausal period, the real challenge is not the medical science. It's the provision of information and education. That's the real challenge, to get this across to women, the importance that this technology is now here, it's available, they can consider it if they wish. That's why an organization like M42 is so important, because in anything that any of us do, it's immaterial unless the message gets out there and that people have the opportunity to be informed and take their own empowering opportunity or choices to go forward.
I think that's a really profound point you make, and it builds on what Dr. Summia said earlier. You used the word autonomy. It's about giving people agency, empowering them with the knowledge and actually giving them access to the technology. So from your perspective, Dr. Summia, when patients come to you, what kind of impact do you think it'll have on the ground? What do you think, how will it change people's experiences?
So, I mean...
And again, the music comes up just at that moment. I'll take that pause just quickly, say, if anyone's got a question, have your hand up, and then we will come to you. Please don't be shy. We can come back to you again. And it gives you a little bit longer to think about that as well. Clearly it's a sign. They're saying everyone should go home, and we're thinking no. We are holding on until we finish our discussion. This is a very important point, but I don't want to gloss over this point.
I guess, Amandeep, why I'm excited about this particular innovation and collaboration is it can really showcase what M42 has to offer and what differentiates us from other healthcare providers in the region. So not only do we have the physical assets that deliver that healthcare on a level of excellence, but our availability of our digital, data-centric technologies, the work of the G42, leveraging all of the information from Emirati Genome Project, the Abu Dhabi Biobank. It's time for us actually to work together collectively and collaboratively so that when a patient comes to me who perhaps has already got her full reading of her Emirati genome sequencing, she has that with her, it's about utilizing it. It's all very well and good of having all of these technologies, but if she's sitting there with a report that she doesn't know what it means or what she can do about it, then that's not very useful. We've got the end products here. We've got technology that will allow her to preserve her fertility, delay the menopause. So if there is something in her genomic sequencing that might show that she has a higher risk later on in her life, then let's really be preventative. Let's be these organizations that offer personalized medicine. And we can do that by leveraging all of the technologies that we have within the M42 assets and working collaboratively. So that's what really excites me about this project.
And it speaks directly to M42's 4 Ps. One of them being prevention, precision, prediction, but also partnerships. And this is what this represents. Absolutely. I'm going to, on the partnerships note, to open it up to the partnership of the audience. Does anybody want to ask a question? This is your last chance. Otherwise, as we've only got a minute on the clock, I'm going to close by asking each of our speakers to speak about where you think this could go in the future, your vision for the future, and perhaps just underline the note of just how unique is this, what's happening here in the UAE with M42 in comparison to maybe a global example.
So I would summarize for me, as far as the woman is concerned, to decelerate the aging process that begins with the menopause, to remove a lot of the stigma, but a lot of the medical issues that arise from menopausal problems. For a healthcare nation, to also relieve it of the vast sums of money that go into supporting medical issues due to the hypoestrogenic state, such as osteoporosis, cardiovascular disease, cognitive decline, etc., etc. So for a medical, technical, individual woman's point of view, I think this is an amazingly preventative technology. And I would see the interaction with M42 as the only route, because you need an organization like them that can deliver all the possibilities this technology offers.
That's really exciting. And because I started with Dr. Summia, I'll end with Dr. Summia, so to bring you Dr. Zahid.
I think, and thank you for the music. It was my turn for the music. So
this is so true.
Let's see if I can be louder. I think in 2025, we've got more women now who are ambitious. We've got more women now who are working. We've got more women now who want that choice to have a baby later. And we've got more women now living longer than ever before. But that switch from a premenopausal woman to a menopausal woman, that makes a big difference in a woman's life, not only just by symptoms, but also by life expectancy. We can stop that, and we can make it slow down, and we can make women be, I suppose, forever young.
Wow, that's a profound point to end on. Dr. Summia.
Very much echo what Dr. Zahid is saying. I'm excited to be able to offer women the choice of just being able to see it as a bank. You're investing in your future reproductive health. And yeah, as the CEO of Women and Children's Care Cluster, that's an amazing service for me to be able to offer to women.
And I love the fact that you use that word exciting, because I believe that it ends our final concluding panel discussion of day one here at Arab Health on a very exciting visionary point, which brings in that decades of science, the expertise that we here have on the stage, but also a vision for the future. We've explored some of the challenges, we've been realistic about expectations, but we're also being visionary and tying into the main themes here at M42. Professor Simon, Dr. Summia, Dr. Zahid, thank you so much for your expertise, your time, and your wisdom here with us. My audience, please give them a big round of applause.
Thank you.
Thank you so much.